The flu vaccine definitely reduces the risk of getting the infection. If a person gets the infection, it reduces the severity of the infection, and it's very clear that it reduces outcomes such as death, which is, one of the prime goals of us carers. Now, a person with lung disease, my area of specialization, with COPD, for example, already has lung damage. They already have reduced lung reserve. So a lot of people who come to me already have only 50% of their lung function left. So when they get an infection, they drop their breathing capacity, and two, they have become susceptible to other bacterial.
Very low immunity. I have two groups of these patients. One is a group of patients who come in for dialysis or have chronic kidney disease stage 3 or 4, which is an advanced level of kidney failure with very low immunity. I also have another group of patients who undergone transplants, and they also have very low immunity. That's basically because they are on medications to suppress their body immunity. We call these immunosuppressive medicines. So in patients who have chronic kidney disease, we need to be very attentive to the fact and other comorbidities. For example,
giving influenza vaccination in pregnancy, because it is protective both to the mother and the child. And coming to the mother, it prevents the complications. Like we all know that during pregnancy, physiological changes happen, and there is change in the immune system, in the cardia, lungs. And so by giving influenza vaccination, this higher risk is mitigated, and otherwise the patient, if the pregnant lady would not have received the vaccine and she develops the infection, there are more chances, as everyone has been telling, that for the infection to become severe, getting hospitalized. Especially I've seen our obstetric patients going into MICU, and there are high chances of developing pneumonia and even mortality.
Very warm welcome to all of you here. I think it's so nice that you could all join us. I know it's
innocence. All our immune system starts to get tired as we grow older. That's a simple way of putting it. So we're not able to easily fight off infections. So what is a milder infection in a young, healthy adult or a child can become often much worse in an older adult, which is why we advise vaccinations again in older people, flu vaccine being one of them. The other is, of course, the shingles vaccine that we advise, and the pneumococcal vaccine. So these are three top vaccines we're advising now. There are a couple of others in special circumstances.
And how does influenza affect people with diabetes, heart, other chronic diseases?
So whenever you have a chronic disease, diabetes being a classic example, the immune system again becomes weakened. Apart from that, we have problems with other systems. Diabetes, for example, affects the heart. It reduces your immunity in the lungs. It affects the kidneys. So when you have organ involvement, heart, lung, kidney, liver, then you're again very, very susceptible to infection. So you get the infection. A young person with healthy systems can fight it off. An older person cannot fight off these infections easily. So that's why it's very, very important for people with organ diseases, no matter what their age, after the age of 18, in the adult, we advise these vaccines, flu being the top one amongst them.
And can flu vaccine help in senior citizens with chronic diseases?
Yeah, so as I said earlier, the flu vaccine is important in older adults, even if they are healthy because of the drop in the immune system. But in a younger person with systemic disease, it helps. It helps to reduce mortality, so death rates come down. It helps to reduce the severity of the infection so that people can fight it off more easily, spend less time in hospital. If they need to go into hospital, very often avoid going to hospital and can be treated at home. So that's the advantage. There's a huge saving in terms of cost, in terms of lives, and in terms of the damage to the system that an infection like flu causes.
And what is your one message for senior citizens on flu protection?
Take your vaccines. Take the flu vaccine, take the pneumococcal vaccine, take the shingles vaccine. The amount you spend on it is well worth preventing any infections. One infection can cause far more problems, cost a lot more than taking the vaccine does. And the vaccines are very safe. Please take them.
the last question is, should the family members also get protected if they have senior citizens at home with chronic diseases?
I like to always advise the entire family to take it, because I believe we should form a ring of protection around the vulnerable person. An older person, a person who has, other diseases, is susceptible. So the people who go in and out, get infections, come back, give it to them. So there must be a ring of protection. All the family members ideally should be protected by taking the vaccine.
Thanks.
I think a lot of it has already been covered. The flu vaccine definitely reduces the risk of getting the infection. If a person gets the infection, it reduces the severity of the infection, and it's very clear that it reduces outcomes such as death, which is, one of the prime goals of our carers. Now, a person with lung disease, my area of specialization, with COPD, for example, already has lung damage. They already have reduced lung reserve. So a lot of people who come to me already have only 50% of their lung function left. So when they get an infection, they drop their breathing capacity, and two, they have become susceptible to other bacterial infections. So that's what a virus does. It damages the lining of the inner lining of the lung, and then other bacteria which otherwise would not cause a problem start causing a problem. So they get a secondary bacterial infection. So what the flu vaccine does is it prevents them from getting the flu infection and then reduces the severity of the flu infection. They recover faster and they don't often go on to get the secondary bacterial infection. The same thing holds good in asthma also. But there's a third group in our country. TB is still quite a killer in our country. TB leaves a lot of lung damage behind. And we recognize that the COPD, chronic obstructive pulmonary disease, which is often thought to be due to smoking or due to exposure to other fumes, also can happen. A very similar condition happens after TB. These people already have lung damage, so they're very susceptible also for infections, and flu is one of the infections that they're very susceptible to. People don't often...
My name is Dr. Jagdish Chinnappa. I head the pediatric department at Manipal Hospital at Bangalore.
Why is flu vaccine important for children?
Yeah, vaccine is extremely important because flu is a very important disease in children. It occurs right from birth onwards. It can go on right through to adolescence. And children are affected because there are so many viruses, and this is one of the viruses that causes quite significant problems in children. What it does is not only the upper respiratory tract, it can cause problems even in the lower respiratory tract. It can produce pneumonia, bronchiolitis, breathing difficulties, and all kinds of respiratory problems. Not only that, but in some children it can even lead to brain damage. And when it leads to brain damage, it's a very serious condition. It also can start off a bacterial infection. Like for example, a ear infection can be preceded by influenza virus infection.
Is the vaccine only for children, or can also be given to everyone?
Vaccine should be given to everybody. Influenza vaccine is one vaccine which you give everybody, not only children, adults, elderly, everybody.
What are the common myths parents have about flu vaccines?
There are two things that parents always are worried about. One is it necessary, and second, is it safe? Now, as far as the necessity is concerned, we have already discussed that it's a serious disease, especially in children under 5 years of age, and therefore it should be given to all the children. And as far as the safety is concerned, it's a very safe vaccine, hardly any side effects, and therefore it should be included to all populations.
Is it recommended by medical bodies in India and globally?
Yes, it is recommended. In the Indian Academy of Pediatrics has got an immunization subcommittee, which is very clear that all children under 5 years of age should get this vaccine, especially those who are also having other problems, and like for example lung disease, heart disease, or etc. But universal vaccine should be given. Children older than 5 years, you can be a little more selective in giving it to high-risk children. We also are important that, remember, one more important thing as far as this vaccine is concerned is giving it to mothers during pregnancy. Because when you give it to mothers during pregnancy, the mother produces the antibodies which cross over and protect the baby for the first 6 months. So it's a very important vaccine to be given at that time.
One quick message you would like to give to parents about flu vaccine for children and themselves?
Yeah, I think it's important that all children should be vaccinated, especially small children. All parents also should take this vaccine, and don't worry about whether it is safe or whether it is whether there will be any side effects. There are hardly any side effects with this vaccine. It's an extremely safe vaccine and protects against a very significant disease.